Good day, guys. So today we will be discussing SVT, atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. Well, what I want to say, from our last class, we discussed sinus, non-sinus, how to calculate heart rate, and whatever have you. We discussed the basics of an ECG presentation, the basics of an ECG presentation. So what we have today is a recap of what we did the last time. So a quick recap. Let's say, for example, we are having this ECG, the first one ECG here, and then maybe we have four boxes in between, four big boxes in between. Four big boxes. Like we said, the formula for calculating heart rate will be 300 divided by the number of big boxes, which is 4, which will give you what? 75. So 75. So the first thing we need to know here is that is it sinus or non-sinus? We know that it is sinus because we clearly see P wave here, Q, R, S, and then T. Then we have another P, Q, R, S, and then T again. So we have P here. So we have P wave. And the second thing we need to know is that is it regular or it's irregular? From these, we know that there are 4, 4, 4 between the RR interval. This is known as RR interval. So it is what? Regular. So first thing, sinus, non-sinus. Then the second thing, is it regular or irregular? Then the third thing, we calculate heart rate, which gave us 75. So let's say we have another image here. Part of this image have been wiped by me. And then maybe the distance between here is like 3.5, right? 3.5. So we have distance between 3.5. So if we're having distance between 3.5, 300 over 3.5, I think is around 125. I might be wrong, but I don't know. So 125 is greater than 100. So this is known as what? Sinus tachycardia. Because P, we have P here, we have Q, we have R, we have S, and then we have T. So P, Q, R, S, T. And then the distance is 3.5, 3.5, 3.5. So this is known as sinus tachycardia. Now the next one we have is what we know as, we have just T wave in between the QRS complex. T wave in between the QRS complex. Two boxes in between, 300 divided by 2 is what? 150. So if we have something that is non-sinus and then it is regular like this, two boxes in between, and then we have T wave in between each of the RR interval. So if it is non-sinus, presence of T wave and then fast heart rate, it is called what? SVT. And from our last class, we know that if you have a normal ECG that looks like this one with normal heart rate plus this one, SVT, it is known as what? Paroxysmal SVT. So today, apart from SVT, we are going to be treating atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. So well, with atrial fibrillation, we need to know how does atrial fibrillation occurs, right? So from our last class, we all remember that here we have what we call the atrium, and then here we have what we call the ventricle. So if for some reason something happens here, okay, here we have the SA node, and then here we have the what? AB node. If for some reason something happened in the atrium, maybe due to metabolic disbalance, due to some electrical changes, or maybe due to some scar tissue, then we now have some scar, inside here that is called the nodules, right? And then these nodules begin to produce electrical activities that is not like the one being produced by the SA node. We might likely have something that looks like this. So the first thing we need to know is that the distance here, we might have 4 big boxes. This one we might have 5. Here we might have what? 3. Here we might have 4 again. The first thing we need to know is that if it is sinus or if it is what? Non-sinus. So if there is no clear defined P wave, it is known as what? Non-sinus from our last class. The second thing is that, is it regular or irregular? If the distance are not the same, it is known as what? Irregular. So once you have once you have an ECG that it is non-sinus and irregular, you should always think about what? Atrial what? Fibrillation. In fact, atrial fibrillation It is known as an ECG that is irregularly irregular. That's a topic for another day. But the main thing you need to know is that it is non-sinus and it is what? Irregular. And in most books, they tell you that the heart rate is over 250 beats per minute or whatever have you. But if you calculate the heart rate, usually when people calculate heart rate, because if it's an irregular ECG, the way to calculate the heart rate is that you will say 300 all over the biggest gap you will have here. Like for example, the biggest gap here is 4, and then the smallest gap here is 3. So 300 divided by 4 plus 3 all over 2. So we have 7. So we'll now have 7 over 2, which is equals to 3.5, right? So 300 divided by 3.5 is 125 beats per minute. But when you are calculating this, you should always think, because here, this QRS, you are calculating from RR interval. And RR interval is ventricular rate, not the atrial rate. If you want to calculate the atrial rate, you need to calculate the distance between PP interval. But for atrial fibrillation, the heart is contracting so fast that the heart looks like it is fibrillating. The atrium itself, not the ventricle, the atrium itself has problem. Hence, that's why we have this wave here. These waves are known as fibrillatory waves. It's contracting very, very, very fast. So you might have 20 contractions of the atrium itself before you have one ventricular contraction. 20 contractions of atrium before you have one ventricular contraction. So that's super fast. But the thing is that the heart is contracting, but the heart is not pumping. That's why people with atrial fibrillation, we are always worried for them about what? Thrombosis. Because if the heart is not contracting, is not pumping blood, what will happen? There will be stagnation of blood in the atrium itself. If there's stagnation of blood, it will lead to what we call what? Coagulation. Like the blood will come together and it will form thrombus. A very good example that you can think for yourself. For example, you stab yourself, right? You injure yourself. If you injure your hand, after some minutes, due to the fact that there is stagnation there, right? Due to the fact that there is stagnation, what will happen? You will form clot. Then the place will cease. Blood will stop coming out. So this is a very good example you can use for yourself. The reason why our blood doesn't have coagulation normally is because it's always flowing. There's always circulation of blood in the body. But once there's stagnation, that's what will now lead to thrombus formation. So for people with atrial fibrillation, we have to be careful about this because there's stagnation and then thrombus can go to the brain and then lead to stroke. So this is the major complication in atrial fibrillation. So the heart is fibrillating. It's not contracted. It's fibrillating. It's just shaking like this because of the atrium itself, not the ventricle. The atrium itself is shaking like this because of how fast the contraction is. But it is not what? Pumping blood down to the ventricle itself. So hence, if you are calculating the atrial rate, you have to calculate the interval between one of these to the other of this. So it will be 0 point something, something, something. So if you do 300 divided by 0 point something, it will give you so fast heart rate. The heart rate will be so fast. So this is atrial fibrillation, non-sinus, irregular. It is known as irregularly irregular. And then there's presence of what? F wave, small letter F wave, which is called what? Fibrillatory waves. So the next one we need to do, this is AFib. The next one we need to talk about is what? A flutter. A flutter is quite beautiful because it looks like this. 1, 2, 3, 4. 1, 2, 3, 4. Then maybe we might have here 1, 2, 3, 4. So for atrial flutter, it's quite beautiful on the eye. Why? Because you have what we call what? Sawtooth. The presence of this. Once you see the presence of this. Because when I was small, we have a carpenter at the back of my house. And then they have a tool they use to cut wood. The tool usually look like this. So this tool, it has what? Saw. It's called a saw. So it's sawtooth. So similar here. So this is known as what? Atrial what? Flutter. Once you see the formation of sawtooth like this, you know it's atrial flutter. And guys, obviously we know that we can't see definite P wave here. So it is what? Non-sinus. Again, for those that are confused, this is what a normal ECG should look like. P, Q, R, S, what? T. This is P. But this is not P because it is what? Sharp. It is as a result of nodules formation somewhere in the atrium. Right? So what this simply means is that the atrium contracts like 1, 2, 3, 4. 4 times before the ventricle contracts. This is known as atrial flutter. Capital what? F. Usually it is what? It is non-sinus and then it is what? Regular. But in some cases it is irregular. In what case would that be? In the case whereby you have AV block mixed with atrial flutter, then it will be irregular. But usually it should be what? Regular. If you get a classic case, it will be regular like this. In some cases, you can have atrial fibrillation and atrial flutter. There's a name for it. Or in a case, you might have AV block and atrial flutter. But that's not our topic today, to dive into all those kind of things. The main thing is that you understand that A fibrillation, you have fibrillatory waves that are like vibratory waves. They are like vibrating. So that's why you have it going like this. And then in atrial flutter, you have what? Sawtooth formation. Always remember the story of the carpenter guy. Now, that being said, we need to move to the other thing. Now we want to talk about ventricles. For ventricles, we have what we call ventricular tachycardia. VTAC, or otherwise VTAC. So here we have our SA node, here we have our what? AV node. So let me tell you classic case, because ventricle is usually affected by so many diseases more than the atrium. Especially things like myocardial infarction. Let's say somebody wakes up in the morning and decides to eat maybe 2 plates or 4 plates of nasilemak, drink 2 liters of Coke, and then in the next 3 hours he ordered pizza, then in the next 4 hours he ordered macaroni, then for lunch he ordered 1 big basket of fufu, then 4 hours later then he's eating butter chicken. Then after that he ordered 10 liters of Coke again. And then in the evening, he ordered pizza. If he does this for a period of 10 years, God will bless him with a condition known as hypercholesterolemia. So what will happen is that there will be lots of cholesterol inside his what? Vein flowing. So if he's not careful enough, this cholesterol will now go to the heart itself. If the cholesterol go to the heart vessel itself, it will narrow the blood vessel. So if this is the normal blood vessel, the cholesterol comes here and it narrows the blood vessel. And then what happened? The heart needs blood. The heart needs blood. The heart needs oxygen. If the heart doesn't get oxygen, in that case, what will now happen? There will be now injury to the heart. That's why we now have ischemia. From ischemia, we have what? Infarction. From infarction, we have necrosis. From necrosis, we have what? Scar tissue. This is one of the reasons of what? Ventricular what? Tachycardia. Now, if that scar tissue starts beating, different from what we usually have like this. Remember I told you that the ventricle is significantly bigger than the atrium. So if the ventricle is significantly bigger than the atrium, what will now happen is that the only thing you will see on the ECG is just ventricular waves, because the ventricle swallows whatever the atrium is doing. In that case, what you will have is just big, wild contraction like this. Now, this is not a good sign. This is a terrible sign when you have it like this. When you have it like this and it looks beautiful like this is known as what? Monomorphic VT. Because it is of one what? Shape. It's called monomorphic VT. Now, if for some reason we have not just one nodules, we have 2, 3, what we are going to have is a different kind of shape. So if we have 2 or 3 nodules here, these nodules, you know that we talked about the heart being able to produce electrical activity by itself. If these nodules begin to generate electrical activity like that by itself, it will lead to something like a ventricular tachycardia. So if Let's say we have two or three. What we now have is something that looks like this. We have this one big, we have this one small, we have this one big, we have this one small, we have this one is. So if it's of different morphology like this, some tall, some small like this is known as what? Polymorphic ventricular tachycardia. Polymorphic VT. So under polymorphic VT, there is another one, which is very, very important that we need to know. Why? Because this one is very beautiful. This one has what we call the spindle shape effect, like this. It looks like a spindle shape. This is a type of polymorphic ventricular tachycardia. This is known as what we call torsades de pointes. Torsades de pointes, for some reason, we use magnesium sulfate to treat it. But for some reason, we don't know why, but it helps. It helps to stop the polymorphic VT. And for ventricular tachycardia, we have, if we are talking about treatment, in terms of treatment, we need to know if the patient is hemodynamically stable or if the patient is hemodynamically unstable. If the patient is hemodynamically stable, that means the patient is looking at you, he can talk, he can feel everything. Then we don't shock the patient. But if the patient is hemodynamically unstable, then we need to shock the patient. Because shocking is electric, you use electricity to do it. And you don't use electricity on somebody who is alive. But if you want to do that, except maybe this person is your ex and you still hate him so much, then you can go on and you do it. You shock the patient. Don't say Kakarama gave you this advice. Well, but you don't do that. But if you intend to do that, then you need to give what? Analgesics. So that in order to prevent the pain, prevent the patient from the pain. Sorry. So polymorphic VT, this is known as what? Torsades de pointes. So now with all I have taught, we'll be doing some lessons from all I have taught now. I'll be bringing some live ECG onto the board and then we'll talk about it. Okay. So we talked about atrial flutter. Okay. Yeah, atrial flutter, we talked about it. We have sawtooth formation, and then we have what? Ventricular contractions. You have normal ventricular contractions. Okay, these are normal ventricular contractions with sawtooth formation. Now, if you are looking at the picture of VT, the picture of VT, you see atrial flutter, we have ventricular contraction like this, right? But for VT, ventricular tachycardia, what we will have is this picture. It's like you enlarge this picture. So you will just have like this. This is ventricular tachycardia. You understand? But here, you will have atrium contraction and then you will now have ventricular contraction. But for ventricular tachycardia, because ventricular tachycardia is very stingy and it takes over the whole heart, you will just have what? Big ventricular contractions. So with atrial fibrillation that we spoke about, we have what? Because people might say, oh, this might be P wave, this might be P wave, this might be, 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 this. You see how stupid it sounds, right? This might be, this might be, this might be. It's not, obviously. So whenever you have this kind of wave, you can see that it's like a shaky kind of wave, right? It's not even full contraction. Normal P looks like this. It goes up, it comes down. But this one doesn't even go down before another contraction, peak, another. So this is not what? P wave. This is not a sinus ECG. So first of all, we know that it is what? Non-sinus. Second thing, it is what? Irregular. because here we have like three boxes, here we have two, here we have four, here we have three, right? So it is irregularly irregular. So we know that it is what? Atrial what? Fibrillation. Now coming to this, if we are doing this task, the first thing we need to start from is that this task here, is it sinus or non-sinus? Obviously, we see a wave that is going like this, long upwards, right? It's going upwards. Usually P looks very fine, very beautiful like this, but this one is shooting up like this. So we know that it's not P wave, rather it is what? T wave. Is it sinus or non-sinus? Non-sinus. Regular or irregular? The distance here, if you look at it from your eye, you know that it is what? Regular. Two boxes in between. So non-sinus, regular, it is known as what? We have what? SVT here. Now we move to the next one. We move to the next one. If you look at it very well. Now, normal ECG should look like this. P, Q, R, S, what? T. Like this, right? And then the next P come like this. Round shape. But here you are having something that's looking sharp like this. Like something my carpenter uses to walk back home. So what do we have here? Is it sinus or non-sinus? Non-sinus. Is it regular or irregular? Here we have three boxes in between each of them. It is what? Regular. So it is non-sinus and it is regular. So we know that it's what? Atrial what? Flutter. Sawtooth formation immediately as we say. So the next thing we need to see is this image here. This image here, we can obviously see something. I'm coming. We can obviously see that there is a shape here. This shape looks like T wave, and then it also looks like what? This sharp stuff. You know that for like this image here, let's take this image here itself. Let's say we now push this ventricular contraction here. So we will now be having something that looks like this. One ventricular contraction, another like we put one teeth instead of two teeth. We have two teeth here, so we put one teeth in between, so we have something that looks like this. Now if we look previously, before we had a picture of SVT also looks like this. Just T wave in between all the RR interval. T wave in between the RR interval. So this picture and this picture looks alike. So in my previous video, I was saying about we use a certain substance to differentiate and to diagnose and to treat if it is what? If it is a flutter here, in this case here, or if it is what? SVT, which is adenosine, because we can't really differentiate. If this is what? If this we are having SVT, or if this we are having a fibrillation, so we administer adenosine. It has to be one of them. So whatever the case is, if adenosine works, if it works, then we know it's SVT, because adenosine is used in the diagnosis and it's also used in the treatment of what? SVT. But if it is a flutter, it will remain the same. Then we administer another treatment. Now we have something interesting here. Here we have a case of T wave in between RR interval, non-sinus, regular here, and then here we have what? Normal ECG, because here we have P, here we have T, we have P, we have T, and then here we have P also, right? So this is a normal ECG here, and then this is a what? SVT. So SVT plus normal is called what? Paroxysmal SVT, sudden onset of SVT. This is known as paroxysmal. So now we move to this next one. We see here, we see sharp sawtooth here. Obviously, we know this is what? A flutter. Then here, we move here. It's quite interesting. We see something that moves like this. We see something come here. We might say, oh, this might be P, this might be P, this might be P, this one T, this one P, this one might. So when you might, you know that it is what? It is not P. So this is what? Non-sinus. Regular or irregular. We see the distance between here. We know that it is what? Irregular. So non-sinus, irregular, A fib. As simple as that. So now we move to something like this. Here we have P wave, here we have QRST. P wave here, QRST. But we see that this distance is a bit wide. So 1, 2, 3, 4, 5, 6. So 300 divided by 6 is equals to what? 50. So P wave here, so it is what? Sinus. 650, we know that normal heart rate is between 60 to what? 100. 50 lesser than 60, it is known as what? Bradycardia. So we have bradycardia here. Here we have a very wonderful case. We have T wave in between RR intervals, right? Just T wave, and it is very fast. So here we have 2. So 300 divided by 2, we have 150 here, right? 150. So here it's non-sinus and regular. So this is known as SVT. And then here we have bradycardia. So we still have paroxysmal what? SVT, regardless. So this is a beautiful ECG from a patient. If you look at it, we take out this one here. You understand? We can see formation of what? Sawtooth. Non-sinus, but in this case, if you watch very well, you can see that what? What do we have? It is what? The distance between here, if you want the distance and the distance here, it's not the same. Usually, a flutter should be non-sinus and what? Regular. But here we have an irregular case. Probably there's heart block there, right? So it's possible that there's heart block. But we see formation of sawtooth. So this is known as what? A flutter. Atrial flutter. Oops. So this is a very good ECG from a patient of from a patient. If you look at it very well, we'll pick up lead 2, right? So if you watch very well, lead 2 is a bit shaky. You see the shaky. You might say, oh, sir, but maybe this is P wave, maybe this is maybe P wave. If it is there, it is there, you know. But these are red flags, you know, red flags all over the place. So P wave is usually, you know, stable and constant. So we obviously know that this is not P wave. So it is what? Non-sinus. And then the second thing here is that is it regular or irregular? The distance between here and here and here and here. Obviously, even somebody blind can see that it is what? Irregular. If it is non-sinus, irregular, we know this is what? AFib. AFib, remember, irregular. Board exams usually like to use this kind of stuff. So the next thing we need to see here is another ECG, very beautiful ECG. Remember I said something about lead 2. Here we have just 3 conjunction, 1, 2, 3. But we brought the ECG down here, you know, lead 2. And then here we have 1, 2, 3, 4. You can count. But immediately we can recognize there's what? A sawtooth formation. Once you recognize there's a sawtooth formation, no need to dilly-dally. Just go straight and say what? A flutter. Now we move further to another example. We have so many examples so that you might understand what is going on. So here we have this kind of formation. You see? Are you seeing the formation? 1, 2, 1, 2. It doesn't look like this again. I keep repeating it. It doesn't look like this, you know. It doesn't look like this. So if it doesn't look like this, it is not this. It has to be something else. It's not a P wave. So it is non-sinus. Second thing, is it regular or irregular? Obviously, we know that it is what? Irregular here. But we see formation of what? Sawtooth. So it is what? A flutter. So the next thing we'll move here. Do we have P wave? We don't have no P wave here. Obviously, we just have some wave, something that looks like this, like this, like this. So here we have what? T wave in between RR interval. And the RR interval is constant until something happen here. Administer adenosine, 12 milligram IV. And then here, the patient start feeling great. With all due respect, we know that it is what? SVT. Now, another interesting case that we have here. Now, if you watch very well, we don't know. We can see that there is obviously tachycardia because one box in between them. So 300 divided by 1 is 300, right? There's tachycardia in between them. So here we are seeing like it's like T wave. Now, the reason why we always, if we see such image, we say it is T wave is because I will explain to you. So here PQRS what T and then PQRS what T, right? With PQRS T. Yeah. So let's say, for example, you want to push this image into here. You are pushing this image. We divide this image into two. So you push this one into here. This P wave, P here, is going to be swallowed by this T wave. The big one will always swallow the what? The small one, right? So in that case, if P swallow T, so what will now happen? The T is here like this, and then the P will now be inside. So when you administer adenosine, like in this case, it releases it. It releases the P. It shifts it. It shifts the contraction. So here, we just see one contraction in between RR interval. We don't know whether it is SVT or we don't know whether it is what? A flutter. What to do? Administer adenosine. So in this case, we look at lead 2 again. Here we can obviously see that there is an image that goes up like this. This one come down. It goes up, it come down. It goes up, it come down. Like this, right? So we know that this is P and then this is T. This is T, P, T, P, right? So what we just do, we know that this is sinus. Is it regular or irregular? We can see that it is regular, like 3 boxes in between, right? So 300 divided by what? 3 will give us what? 100. So it is what? A normal ECG. Normal sinus ECG. Maybe with a bit of tachycardia because I just approximated the 3. It's around 2.5. So sinus tachycardia we have there. Premature ventricular contraction we are going to do on our next class. We are going to do on the next class before we do AV blocks. But today we want to clearly explain. Come here, come here, come to me. Technologia. So today we spoke about this. I told you if we have heavy contraction like this, my goodness, if we have this kind of heavy naughty contraction like this, just something that is very greedy and it takes all over the place, just ventricular contraction, we know that this is what? VT, 100 to 200 beat per minute. Same also, we have this VT that looks very beautiful, which we talked about the other time. This is known as what? Tosades de what? Pointis. Then we didn't speak about this. So if we have something, you know, we say this is V tachycardia, right? We say this is ventricular tachycardia, up and up and up. So whenever we talk about fibrillation, it looks more like vibratory wave. Remember, if this is tachycardia, ventricular tachycardia, this will be what? Ventricular what? Fibrillation. Because it's fibrillating. It's bad already. It's like a case of vibration. So that is what we have here. Ventricular fibrillation usually smaller than what? Ventricular tachycardia. Ventricular tachycardia looks a bit pretty, but it's very bad in clinical case. But here we have something what? More, smooth. Oh my goodness. No, 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 no. Now, Now, in clinical cases, usually what happens is that after a case of extra systoles, After a case of extrasystoles, we are going to have what like this. The heart is going to try to compensate, it's going to start contracting so fast. The ventricle misbehaving. Then when it gets tired, this happens. Then after this happens, it gets more tired. So here is what we call VT, the big one, VT. After VT, ventricular tachycardia, we have ventricular fibrillation. Then here we have a case of what? I am on the other side. I am on the other side, IOS. This is already asystole. Absence of contraction is known as what? Asystole. So, if you see this one, this is AFib. This one is AFib. You can see fibrillatory wave and you can see ventricular contraction, right? But here you just see just fibrillation. It's like you took this one and then you just place it here. I told you the ventricle is very stingy. Whenever it is misbehaving, it takes all over the ECG. So it took all over the ECG. Now we can't see any other thing apart from ventricular contraction. Immediately we know this is what? V fibrillation. Fibrillation usually smaller than what? Tachycardia or flutter. So in this case, we can see sharp movement up and down, up and down, up and down. So we know that this is what VTAC. This one also, we can see it's a picture from like this one. So this is also what? VTAC. This case also, obviously, we can see that we have multiple contractions like this. Contractions like this. Don't confuse this with SVT because a lot of people might do that. For SVT, we have T wave and then we now have this contraction, T wave with this contraction. You'll be seeing something under. You get it, right? Something under like this. But in this case, you can see that there is no T wave in between all these things. So SVT looks like this, but this one looks like it's sharp. The next one goes, the next one goes, the next one goes. This one is our friend, the beautiful one, which is known as what? The spindle shape formation. Ladies and gentlemen, this is the second part of the ECG lesson. If at the end of this lesson, actually, like you still don't understand atrial fibrillation and what we have taught today, you can text me and I will send you an apology video for wasting your time. Thank you.